Welcome, everybody, and good morning. My name's Shane Simpson, and I'm happy to be your host today. I'm here on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people in Vancouver, and I'm sure that all of you in your different places around the province and elsewhere are in the territories of Indigenous people who have made this their home forever, and we want to recognize that. I'm very pleased on behalf of NIDMAR, the National Institute for Disability Management and Research, to be your host today on this webinar, Building a Culture of Accommodation in the Workplace. Our objectives for today, as this is a section that is primarily healthcare workers, is to really continue to build on the good work that's been done in the healthcare sector with the Enhanced Disability Management Program, and to continue to build on that work through the efforts of NIDMAR and the Workplace Development Agreement that we have in place with the provincial government to provide additional supports to enhance that work for workers who have been injured or who are off the job and looking to return to work and related disability management issues. We're going to Today, our real objectives are to raise awareness around those issues of disability and related poverty, and we know that they are closely connected. To talk about how skilled disability management practitioners and informed stakeholders can improve return to work outcomes for disabled workers through accommodation and efforts such as that. To give you a little opportunity to understand the opportunities under the WDA initiatives of NIDMAR for continuing education, for professionalization, for program supports, including workplace audits that will help organizations to understand the scope and effectiveness of their own initiatives and look at ways to enhance that, and to truly build a culture of accommodation that will reduce poverty in our province, will create opportunities for persons living with disabilities, and will hopefully enhance the workforce at a time when we all are feeling the pressures of needing people, skilled workers, and there's opportunity here for us to look at that. So we'll be exploring how the healthcare sector could use the funding of the WDA grant as one tool to help do that work. And we'll also talk a little bit about the accessibility and inclusion legislation that is in place provincially and federally at this point, legislation that that obliges certainly the public sector in British Columbia at this point, but will oblige our society to be more accessible and more inclusive for persons with disabilities. And included in that, this is a significant piece around employment and how we create employment opportunities moving forward. We're going to, we have a number of speakers who will join us today. We have an initial panel that will be doing that work, and I'll speak a little bit about my two colleagues on the panel. Wolfgang Zimmermann, who is the CEO of NIDMAR and the founder of the Pacific Coast University for Workplace Health and Health Sciences, which provides that training and certifications for disability management. Wolfgang is a leading thinker and activist in the areas of return to work and disability management, and certainly has been the driving force behind many of these initiatives and is recognized globally for his efforts. And of course, Wolfgang, as many of you may know, he comes to this because of initiated by an injury when he worked in the resource and the forest sector and was injured in the forest sector. And that's probably what turned Wolfgang's head to this initially. We're also going to hear from Dr. Craig Goss, who's really a leading practitioner in the areas of occupational mental health, including consulting with workers' compensation groups, and we'll speak more about some of those issues. And this is particularly critical as increasingly we see mental health issues growing in terms of the large numbers of people who are facing struggles that take them out of work at different times. We'll then be hearing also from leaders in the labor movement, labor leaders who are a critical piece of this in the healthcare sector moving forward. And that includes Amin Gruel, the president of the BC Nurses Union, and Lynn Bickert, the assistant secretary, business manager of the Health Employees Union, two leading unions in the healthcare sector, and unions that have been instrumental in doing work to help ensure that we've had success, and there has been significant success in the healthcare sector around disability management, and what that will look like moving forward. And then we will hear from Lanny, who DeHeck, who some of you will know, a registered nurse, but most importantly for us at NIDMAR, somebody who's come and has been helping us at NIDMAR to put these programs together and played an integral role in that. So I want to start though just to add a few comments myself, and then I'll turn it over to Wolfgang. At the end of these comments, there'll be a Q&A period, an opportunity for questions and answers a little bit later in the program moving forward. I came to this work, I was first elected as an MLA about back in 2005, and as an opposition member at that time, I had a number of critical responsibilities like labor, social policy areas. And I came to know NIDMAR's work through that time in opposition, and became a very big supporter of the efforts to look at how we get people back to work, what that looks like moving forward. And how we accomplish that. Then in my time as we moved into government in 2017, I took on my responsibilities as the Minister of Social Development and Poverty Reduction, which included most initiatives related to persons with disabilities. It became very clear to me at that time the struggles that persons with disabilities were facing, the challenges that they were facing, and our need to respond to that in terms of legislation. And we did that through the poverty reduction strategy, but we did it also by putting in place the accessibility and inclusion legislation, the Disability Act in British Columbia. And that act was passed in 2020, 2021, and now has created an obligation and an expectation for us to do better around accessibility and inclusion. And we know that that's a critical piece. So I've been very keen about that, and I was very excited when Wolfgang asked me to take on responsibilities to chair an executive steering committee that would support the work of the Workplace Development Agreement grant, which is a grant that's been provided by the province for multi-year support for NIDMAR to do the work that it's doing. That work came out of the efforts that we put in place to look at how we generate employment opportunities. Work BC, which is the employment programs in British Columbia, supported by the federal government through funding that were under my ministry at the time. We restructured those programs to move them and focus them more on people who had more complex issues, including people in the disability community, and how we could help them to better get into the workforce and stay in the workforce. And as a piece of that, this support for NIDMAR and for the efforts of NIDMAR was brought forward. You'll know that there's about 130,000 people on disability assistance in British Columbia right now. They struggle, they're poor, they have challenges. There's a lot of work to be done to support that. But we also know that people who are in the workforce, and significant numbers of people in the workforce who leave either because of an occupational injury or disease, about 30% of the people who leave the job are because of an injury or disease, and about 70%, give or take, leave the job because of health-related issues that aren't necessarily around an injury, but they are very real and they take people out of work. And we know that if we don't get people back to work within about a year, maybe even less, the likelihood that they ever come back to the job is slim. And so two things happen. One is these people's lives are irrevocably changed in ways that usually is not positive at all. And you lose important and critical workers in the workforce. And we know, of course, in healthcare, the demands and the pressures for workers and skilled employees in the healthcare sector, as in many sectors, is pretty critical. The legislation that was brought in, the accessibility and inclusion legislation, looks to change that to some degree. And one of the critical factors in that legislation was in the last year, the government has enacted sections 13 and 14 of the Accessibility and Inclusion Act. And what that essentially has said to the public sector, the entire public sector, whether it's local governments, education, healthcare, universities, across the sector, is they essentially have 1 to 2 years to put a comprehensive plan in place with a consultation process, and they need to do that to meet the requirements of the law. And we are increasingly seeing those organizations, as they wrap their head around what that work looks like, being interested in this aspect, disability management, as a piece of the work that they do moving forward. So we're seeing that at NIDMAR, as increasingly folks are coming and talking about the work and the support that NIDMAR can provide moving forward, and also looking at what their plans are going to look like. So we see this as a real opportunity, and the intention here very clearly is to put this work in place in the public sector first, and then to move to the private sector as stage 2. The federal government also has disability legislation in place, and it certainly fits for federally controlled organizations and businesses. But I think it's a reflection of the expectation and demand around accessibility and inclusion across society that we need to do a better job. And we know that that means creating opportunities for people to get to work, to stay in work, and to be able to move forward. And that's a critical piece. I certainly know that when I was doing the consultations for the accessibility and inclusion legislation and spoke to people with disabilities across the province over an extended period of time, every day I heard from people that one of their critical issues is they wanted a job, they wanted to go to work, or they wanted to go back to work. And they wanted to go back to work both so that they could improve the standard of living for themselves and their families and their loved ones, but they wanted to go back to work because they had value, they had things to contribute, they wanted the opportunity to do that. It's not lost on people, and we all know this, that when you meet somebody, well, pretty much the question after what's your name is what do you do? And they wanted to be able to answer that question in a different way than they answer it today. And these are people with a wealth of skills, with commitment, the need to go to work, and we need to create that opportunity to be able to change their lives in a positive way. And very much for people who have been in the workforce and who have had to leave the workforce either because of injury or health issues and want back. We have an obligation, all of us, to create that path back in a way that makes sense and is accommodating and will both bring value to the worker by putting them back on the job and value to the organization. We know that the costs drop dramatically if we can get people back to work. So those are very much areas that we need to move forward on and do our best to try to see how we can support people in that work, and that's certainly what we're doing here. I think at this point, I'm going to turn this over to Wolfgang and ask Wolfgang to speak further on some of these issues as our resident expert on these things. So I'll turn it over to Wolfgang Zimmermann.
Great. Thanks a lot, Shane. Appreciate all your kind comments. I don't know about the resident expert. You've done a tremendous job in this, in advancing the agenda for people with disabilities, and I certainly want to thank everybody who is participating today because it's an issue. And you referred to the fact that you know, I literally got into this situation by accident, and I want to use and highlight perhaps one particular aspect of that. I got hurt. I'm dating myself here, but that was 45 years ago. First week on the job, working for a company called McMillan Waddell, which was British Columbia's biggest employer. And it was one of those situations where here's a power saw, good luck, go for it. Absolutely no training, and 50-foot alder came down on me and broke my back and left me with a severe spinal cord injury. And coming back to your point in terms of the importance of work that you referenced, Shane, it was immediately obvious to me, certainly, that I wanted to go back to work in whichever way that was possible. I was fortunate that I had initially graduated in civil and forest engineering, but going back to work was a lot easier said than done, obviously, having to go through rehab for a year. And but at the same time, I was very fortunate that it was a large organization, and the union, the IWA, at the time, that I then carried on with, and being a lifetime member of the Steelworkers. Now, collaborated. The company accepted responsibility for the accident. Obviously, there was no legal question because it's a WECB situation and it's a no-fault system. But morally, the company did accept responsibility. And the camp chair, this was a logging camp. We had about 450 guys working there, just outside of Port Alberni here on central Vancouver Island, in literally in the bush, and the HR manager for this particular camp, which was about as inaccessible as you'd ever find it, being a logging camp in the bush. And there were about 45, 50 staff working there. They decided, yes, we are going to support this. It was a joint effort between both sides. And in those days, you know, on average, we had a fatality on average about every 18 months. That was in the late 70s. I mean, it was, you know, across McMillan Waddell, there were anywhere between, you know, around a dozen or more fatalities and disabilities in the forest industry. But what it ultimately came down to, and why I'm raising this, is that after both the union and the company agreed that I would go back to work, it took the engineering department probably about 3-4 hours to figure out how to build access, how to build safe access to the building. Then it took the carpentry crew and the construction crew about a week, I guess, to build the ramps, to widen the doorways, to make the washroom accessible. And so I was able to get back to work, and I was the first one. And after I came back, there were a number of other individuals that came back to work. But what the key in all of this was, it was the attitude of the workplace that made the difference. Because if it hadn't been for the support from the union and the company, but obviously the union being the first one to stand up, a fellow by the name of, as I mentioned earlier, Nick Boss, the camp chair, and becoming a huge champion of this. The fact that the building was inaccessible would have been the reason why it would have never have gone back to work. And that's really the key. It is the attitude with the level of technology and knowledge that we have. If we apply the 3 C's in terms of creativity, collaboration, and commitment, that is absolutely critical. When I look at it, and so I've been incredibly fortunate to have been able to carry on working and avoid the situation that Shane just described, which faces so many individuals with disabilities. We have 1.4 million people with disabilities across Canada that live in poverty. And 30% of them or more live in deep poverty. That means that they're actually substantially below the official poverty rate. And the tipping point, and Shane mentioned the 1+1 rule, that if somebody has been out of work and is on disability support for a year, there is a 1% or less chance of ever going back to work. And the outflow rate from this system is less than 1%. That means, and there's no jurisdiction around the world that's been able to make a significant impact in this. Less than 1% will ever go back to work. So we need to intervene early. And the work that we had done and are continuing to do with Shane's former ministry. So I guess we'll carry on. As I said, technology is just one of those things. So, but
should we change the topic? I'm wondering, should we change the topic to stress management?
You got that right. Yeah. No. So where I was, and it is really the whole notion of the attitude is just so absolutely critical in terms of building this level of support. And as I was saying in a previous iteration, when we look at the data here in our own province, with an outflow rate of 0.65 to 0.85%. But what I always struggle with, because we talk to a whole lot of individuals that really have never had a chance to go back to work, where there is no support system in place, where you really don't get returned to work, and all of a sudden you get pushed to the margins of society. When you think that people with disabilities that are unemployed have a suicide rate that is about 40 times the average population. And I remarked earlier to somebody that I was really quite amazed that an organization like Maple Leaf Foods has jumped onto the bandwagon and is very much looking at supporting the whole notion of a disability benefit. But what struck me as well is that 41% of people living with low income have a disability. And with the added cost of living and physical barriers, they're especially vulnerable to food insecurity. Recent study found that households with a person with a disability had nearly twice the likelihood of experiencing food insecurity compared to households without a person with a disability. So that speaks to all of our collective efforts when 80% of all mental or physical health impairments happen during somebody's working life. And that's where the attitude at the workplace is so absolutely key, and why I am forever grateful that I was not forced down that path, but that there was the support of the union, which was critically important because the company would not have done it on their own or from the goodness of their heart. It would have been just another number, another case, and here you go, as opposed to continuing to be, you know, a member in our society. I will just leave this. Shane mentioned the 30% of occupational of all disabilities are based on an occupational causation. Last year, the ILO for 2020 reported that there are 7,500 workers around the world that die every single day from a work-related accident or disability. It's really quite staggering. It's 2.78 million per year. And even in this country, we still have about 1,000 occupational fatalities per year. And that number has not changed over the last 10 years. And for every fatality, there are about 25 permanent disabilities. So we all have a huge role to play in maintaining equitable access, and when staying in the workforce is absolutely key. And it's the attitude. We have the solutions. We know what needs to get done. What it does require is commitment. It's not good enough. Certainly, it's a step in the right direction. But I think we all know that we know what we need to do. But if somebody doesn't provide the leadership and take on the responsibility and actually make it happen, a study by the out of the UK, just very recent, is that 99% of the largest companies in the UK have a disability inclusion mission statement, but less than 50% have actually got a program in place that will ensure that somebody actually does go back to work and stay in society. So I think we've got a tremendous opportunity. All of you can make a difference, and certainly I was most fortunate to have been able to carry on and appreciate the value of that. With that, Shane, it's back to you.
Great. Well, thanks, Wolfgang. Much appreciated. And I think the point you make about changing the culture of how people see disability and the role of people with disability is pretty important. I'm really pleased that, as we know, increasingly, we're learning more about mental health issues, about the challenges of mental health. We know about how that has been, that those challenges exacerbated by the pandemic, and how people's lives have been affected by that, and how it affects people in the workplace. And we're very pleased to have Dr. Goss with us to talk some more about that and about how we move forward. So with that, I'll turn it over to Dr. Goss.
Thank you very much, and welcome to the webinar, everyone. I will hope this works technologically. Can you see my slides?
Not yet.
Not yet. Okay, I've shared and it should be showing. Is anything showing?
No.
Nope. Okay. It's loading.
Wonders of technology.
Yes, I'm clicking to share, but it's not sharing. Can you just see my face?
We just see you.
Okay. Any suggestions? I remember last month we had the same problem. Not sure what.
Olivia, are you able to help out with the PowerPoint? Oh, sorry, she's just on the phone, I think, with Zoom. Sorry. We do have your slide. Olivia here. Oh, here we go. Now
Here
it's
we
sharing.
go. I think we're getting started.
Yeah,
There we
Okay.
go.
I'm going to change my talk, as I said to Wolfgang, to stress management. Okay, so people can see my slides now. Okay. I'm a psychiatrist, a clinical person and work in occupational psychiatry. So I'm going to have my comments mostly from a clinical perspective and not as regards policy and planning. And I'm going to talk about vignettes about mental health disability management in the workplace, and particularly the areas of accommodation and the need for collaboration and cooperation in that sphere. This is a timely intervention because COVID has really brought the workplace inadequacies to the forefront, and we can very clearly see what is needed more so than in past years, and we're getting more attention and more resources applied to it. And particularly of concern to mental health clinicians is that the workforce has many marginal workers that before all the stress of the current world were coping, but now their margin is shrinking and they're likely to be not well, not doing their job well, and eventually going off sick and being lost to the workforce and to productivity. Just to give you an idea of this, 50% of Canadians have decreased mental health, 10% markedly so, and the symptoms of anxiety are very prominent. Worker health is down 80%, is down, and 80% impacted. 80% of workers have been impacted by the COVID pandemic. So this has really pushed the boundary of what our coping ability is in the workplace across Canada. We notice alcohol use is very much up, particularly between the ages of 18 and 54. And there's a greater than 20% increase in usage. And we know that alcohol is an anxiolytic, is an anti-anxiety. So people are probably self-medicating because of a sense of deep stress. And as with any piece of machinery, the more you stress it, the likelihood that it will break and cause problems. So we're seeing that with people. And in fact, 15,000 deaths per year are alcohol related and are likely to increase. So it's a very important time for disability management, particularly identification of marginal workers and those needing help. And it's cost effective because it's much cheaper to support a worker in the workforce who is doing something productive than to have him off being treated. You're paying for the treatment and you're also paying his disability salary, and you're probably having to pay somebody else to do his job. So having somebody off work is tremendously expensive for the economy. And also, as previous speakers have alluded to, it's very devastating to the mental health and self-confidence and self-esteem of the worker to be off. Early investment is thus an investment and a prophylaxis. It identifies workers who are at work, but at risk, but they are still functional. And so by identifying these workers and treating them, you increase productivity and decrease individual morbidity tremendously. And the main thing, I've worked at occupational psychiatry for many years now, and there are four legs to the accommodation situation. You need the worker to be identified. You need to have the employer sympathetic to the situation to deal with it. You need disability management, usually coming from the insurer, Manulife, Sun-Life, or the other big private guys, or workers' compensation boards. And then collaboration with the treating source, the clinicians. So these are four components. I see them as, you think of a transmission. We have a transmission with four cogs. The cogs have to mate well for the wheels to turn maximally. And quite often that doesn't happen. Those four cogs do not always match up very well. And it's important now that the focus has come on mental health because of COVID, that we learn to make these four cogs fit better. We need true employer buy-in, not just lip service. So we need, when there's an accommodated position, it needs to be meaningful and create some self-respect and value within the individual doing it, not somebody sweeping the floor in the corner. And it needs to be what the employer, it needs to be what the employee has agreed to and the disability management team has set up. I've had so many workers agree to a disability plan to be supported at work. And what actually is happening at the workplace is very different than what's on paper. So we need a true employer buy-in and a valid return to work program or a stay at work program, depending on what it is. So the quality of the accommodation is crucial. It must be meaningful. And the other issue is we see lots of employees put off on disability because in truth, they're problem employees, and the employer would rather have them out of the workplace, and they're quite happy to pay the disability, but that's not the best use of the system, and it's not the best for that individual. So really, to identify and fund treatment and have the person remain at work is very cost effective. As I pointed out, you only have to pay for his treatment, and that's another issue. The system is so blocked that people nowadays are not getting optimal treatment. They're not getting negligent treatment, but they're far often getting suboptimal treatment, and that's delaying the return time or the time for implementation of a modification or accommodation at work program. And as Mr. Simpson mentioned, the longer you're off work, the less likely you are to go back. So some people are sliding past their opportune time because of lack of adequate treatment. And workers' compensation boards have a bit of an advantage with that because they can access services outside the system, whereas other like Sun Lifes and Manulifes and all these, they can't buy service and treat directly. They have to rely on the public service, which, as we know, is very much strained right now. So there needs to be a look at availability of treatment, because again, it's much cheaper to see these people get optimized treatment and get back to work and full productivity in a quick time than to remain off work. Usually they deteriorate emotionally because of self-identity and quality of lifestyle. And also they get out of touch with their work environment. They're not up to date on the latest things. So there's a tremendous deterioration. So these four cogs need to be equal. So right now the treatment cog is kind of mini and the other cogs are larger. So you like to have those cogs proportional to each other so that the system works well. The other issue is identifying those in need of help. There are a lot of hidden workers who need help but are afraid to show it. We need, again, a benevolent work employment situation where the worker knows that if he identifies he's not coping, he won't be fired or shuffled off or put in a situation that's not to his benefit. So we need to help identify the hidden ill, those who are smoldering but not yet on fire. So we want to have screening programs and very much show them that this is truly a positive step that identify yourself and be helped and get well. And the other thing is, one of the big side effects of COVID is social isolation. So many of the workers have now been sent to work from home, so you don't see them. You don't know who's getting sick or who's coping. And studies are now showing that it's a double-edged sword working from home. At first, everybody thought it was great, you're at home. But what we're finding now is that people are rolling out of bed in their pajamas, sitting in front of the screen and having a screenshot of palm trees, and you never know what their true state is. There's loss of socialization. A lot of single people living in a one-bedroom apartment, they live and work in the same place. They have no differentiation between home and work, and that's not very good for mental health. So we need, in disability management, to develop ways and screening techniques to identify who these people are that need help, who are working in isolation or at home. And it's a huge issue. We see so many referrals from people who are in social isolation and have turned to drinking, to smoking drugs, to depression, and nobody noticed it. They got very sick before they crashed, basically, before it was identified. So for disability management, we need to very much look at ways to identify these social isolation workers, and that's a huge cohort of the worker now. And so that's an accommodation challenge. How do you accommodate somebody at home? So really what these people need is more social contact, so that the job needs to have more people interaction, even if it's video, as opposed to bringing them into the office necessarily. Although we're probably going to find that we need to have a blend with office-based and home-based, that most people will not really over time do well just working at home. So basically I've said this already, but working at home is good for infection risk, but bad for mental health. And they're the ultimate hidden worker that we need to identify. And there are a lot of these workers out there that are working from home who are not well at all mentally. So who else is vulnerable to mental health effects? Healthcare public health workers. They have too much social contact, too much negative emotion. They're bombarded and they crash. And again, a lot of these people are working in situations. I'm thinking of ambulance drivers, paramedics, the tremendous incidence of post-traumatic stress hidden in this group, and often not identified and not volunteered by the worker, because it's quite often a very good job and nobody wants to say, hey, I'm sick, I can't work. So again, spreading the word that disability management, accommodation, and that is very positive, and that we have a collaboration with the employer, that there will not be negative consequences, but rather positive if you identify yourself, rather than us have to try to seek you out. And female workers are having a particularly hard time of it at home. Domestic abuse is increasing. Often the husband or the partner and the wife, or the partner, two partners are together in the small space working 24/7, and it leads to friction and deterioration, particularly if it was a marginal situation before. Indigenous people are already stressed, frequently marginalized, and intergenerational traumas. They're very much particularly at risk for deterioration and a particular disability management challenge. These groups as well are not terribly self-advocating, and so they don't come seeking help. They need to be sought out. The workers without help is a potentially huge liability for provincial workers' compensation programs, as many of these workers will eventually run out. The battery will run down and they'll stop working, they'll go off on disability, and they won't get perhaps optimized treatment, or there's not an adequate accommodation modification program in the workplace. So there's a high risk that we're going to lose a lot of these workers to the workforce. That is totally unnecessary. We need to have these four legs working together. We need the employer willing to recognize and appreciating the value of identifying workers who are smoldering, and provide resources and meaningful accommodations to them. And the understanding that over time, the accommodations should not be permanent for most people. They will recover to their previous functional level. And it's much cheaper to treat it at that level and wait till they are off on disability. We need to have more substance use programs. The incidence of substance abuse has increased tremendously. And again, what's happening is disability management a lot of times is identifying workers at risk, but trying to access timely treatment and trying then to have a collaboration effect with treaters. It's very difficult. So I find this 4-cog transmission is needing of a lot of work, that the 4 components that would optimize the worker recovery and productivity don't always work well together for various reasons. And I think that's an area we need to highlight, the collaboration, that disability management alone, medication alone, doctor alone is not enough. It's the collaboration. First, there's the identification of the worker at need, and then the collaboration of what needs to be done. And the collaboration, I think we need to really put a lot of effort into. And mental health access is very difficult. People who were well before have now become marginal because of the stress of COVID. People who were marginal before have now become ill and are really struggling to stay at work. And there's going to be a significant number of workers who will need acute and medium-term treatment to avoid chronic mental illness. We want to identify and prophylactically provide service disability management accommodation to these people so they don't become lost to the workforce. Maintaining people in the workforce is cost effective, both financially and at a human level. And so we want to identify accommodations and job modifications. And then you raise the issue sometimes of potential employer hardship. So you really need to help the employer understand the value to them of working with disability management in accommodation situations. And in closing, mental health has always been a significant pre-COVID workplace issue. It's much, much worse now. Tremendous amount of mental health hiding in the workforce that is eventually going to crumble. It's like rot in a post. Right now the post is holding, but over time, if the rot's not fixed, the post will fall. And I fear that's the workplace situation. There are so many workers there who are working with not well. And we need to work collaboratively. And that's the greatest opportunity we have to make things better and to keep the productivity of the Canadian workforce good. And the federal government's attempts now in funding for new initiatives, I hopefully will enable further work and service provision in that area. And hopefully a lot of these workplace issues over time will get better, particularly if the four components of the disability management, the employer, employee, insurer, and the treating team all work together. And to date, that's, I think, the area we can put the most effort in and get the most return. Thank you for listening to my clinical comments, and hope you continue to enjoy the webinar.
Thank you, Dr. Goss, and I think your comments about collaboration are really essential. And as we know, as we try to, and I think we're getting better at it as we reduce the stigma around mental health and understand it better. Hopefully, we get to more effective treatment there. Everybody on this webinar is involved and active in some way in the Enhanced Disability Management Program, which has been in place for 10 years now. A program that really is a success story, I think, in terms of dealing with some of these disability management issues that we're talking about today. A program that has 11 to 12,000 referrals annually. So it's very significant, and I know we're very interested in an evaluation, a comprehensive evaluation of the program that's ongoing now and will soon be available. And lots of us are looking forward to understanding better what the impact of the program has been. What we do know about the program is its success has been around collaboration. Its success has been around the ability for employers and unions and that to work together to create the best opportunities for healthcare workers to be able to deal with issues when they face them and to be able to do their work. So we're really pleased as part of today's effort to have two leaders of the significant healthcare unions in British Columbia participate and be part of the work that we're doing. So I'd like to introduce Aman Grewal, who's the president of the BC Nurses Union, and ask him on to make some comments.
Thank you, Shane. I'm going to have Olivia share screen for me, please. Thank you very much. So I'd like to start off by thanking Lonnie for inviting me to present this important topic for our BCNU members. And I'd also like to recognize the great group of panelists that are here today. So as mentioned, I'm Aman Grewal, president of the BC Nurses Union. I'm a registered nurse, and I'm also an injured worker who has gone through the EDMP process for a workplace injury, and I'm quite aware of how you need to remain connected with the workplace and that need for accommodation in the workplace. We also need to acknowledge the invisible disability, where a person is suffering but looks fine to others, and people are always wondering, why are they off sick? Why are they, taking time off, but they look fine? And so just as Dr. Goss mentioned, at the moment they're working alone at home and it's quite hidden. I think it's very important to start by saying BCNU remains committed to working with NIDMAR, employers, HEABC, the ministry, alongside our union partners and our membership to continue to build a culture of accommodation in the workplace. BCNU first bargained the EDMP back in 2010, as we know the importance of early intervention support, good disability management, and accommodation policy, the positive outcomes that can be achieved for our members. Next slide, please. So the mental health crisis has existed for BC nurses prior to COVID-19. As we have been also dealing with an opioid crisis taking far too many lives, and that is having a negative impact on our nurses' mental health. dealing with the death of young people, sudden deaths. BCNU, with its membership, has raised awareness and alarm bells on the many challenges our membership has faced for years on the front line. Since the start of the pandemic, the mental health of our membership has become excessively worse. Burnout, depression, anxiety, PTSD, and workplace injuries, both physical and psychological claims, are on the rise. Nurses who are struggling at work or off on short-term or long-term disability are not getting the supports they need in a timely manner to address their restrictions and limitations. We must look at providing supports earlier to keep our nurses safe at work and support them in their return to work when they are ready. The mental health crisis is coming at a time when our healthcare system is completely overwhelmed, and we need the health of our nurses now more than ever to ensure good patient care and have a functioning healthcare system. Next slide, please. So in 2019, a cross-sectional province-wide survey study of nearly 4,000 nurses was conducted by BCNU to explore the mental health state of nurses in the workforce in BC. This study looked at the mental health and burnout rate of nurses pre-pandemic. So this is prior to the pandemic. We did not know what was coming at us then. Mental health problems were about 1.5 to 3 times more prevalent among BC nurses compared to their peers nationally. Nearly 1/3 of BC nurses in the study suffered from depression and anxiety, half from PTSD, and at least 1/3 from burnout. Approximately 35% of our nurses that were involved in this study met the criteria for burnout, and over 2/3 reported problems with one or more dimensions of burnout. Burnout is an occupational syndrome resulting from chronic workplace stress and is characterized by high levels of emotional exhaustion, depersonalization, and reduced personal accomplishment. Given the correlation between mental health disorders and nurse absenteeism and increased turnover, we must look at the state of nurses' mental health in BC. Again, this study was done pre-pandemic, and things have become much worse. For example, our emergency room nurses, the need for closures of the emergency rooms due to staffing across the province. We know there is a nationwide nursing shortage forecasted, so we need to act now to assist those who are on the front line and prevent burnout of our nurses. But we actually know about it. We've known about this looming for decades, but nothing was ever done to prevent the severe nursing staffing crisis we are actually facing right now. Next slide, please. So, workplace policies to support nurses. One of the many ways to address the mental health crisis and decrease the burnout rates of nurses is through improving workplace conditions and providing earlier support to nurses who are struggling at work. And right now we know that our young nurses who finished their training in COVID and have come to the workplace and are working short, they're being impacted by this as well. BCNU participated in a study with UBC in 2020 to look at how workplace conditions impacted mental health of the nurses. The study found concerning prevalence of rates for PTSD, anxiety, depression, and high emotional exhaustion. The study also found negative ratings of workplace relations, organizational support, organizational preparedness, workplace safety, and access to supplies and resources were associated with higher scores on all the adverse mental health outcomes included in this study. If you recall, access to the appropriate PPE was quite a challenge. There's been a lot of workplace toxicity. The culture needs to change, and we need to be supporting our nurses. This study concluded that better workplace policies and practices are urgently required to prevent and mitigate nurses' suboptimal work conditions. BCNU and its membership has worked with employers, HEABC, the ministry, and NIDMAR for many years to address the need for better workplace policies around health and safety, disability management, and accommodation. But not enough has been done to address the ongoing mental health crisis. Next slide, please. So BCNU believes strongly in the EDMP, providing early intervention and accommodation to help keep nurses connected to the workplace and provide that support that they all need. That has been proven to be very effective. Building a culture of accommodation in the workplace is necessary to address the mental health crisis and staffing shortage nurses are facing. We know there is a legal duty to accommodate, and we need to work together to get nurses back to work sooner when they are medically ready. Early intervention, disability management, and accommodation are proven best practices that help keep nurses safe at work, return them to work in a safe and timely manner, and retain skilled nurses who are unable to perform the duties of their own job, but can be accommodated through alternate work. BCNU applauds the work being done through the Workforce Development Agreement, the new Accessibility British Columbia Act, and the EDMP. Importantly, BCNU will continue to advocate for the EDMP and good disability management policy that is based on best practice, as it has shown proven benefits to our members. More work is needed, but there are good steps in place right now. We're going in the right direction, and BCNU is committed to working with all of those here to continue to support our nurses during this crucial time for healthcare. Thank you.
Thank you, Amanda. Much appreciate that. I'd now like to ask Lynn Bickert, the Assistant Secretary Business Manager for the Health Employees Union, to make some comments on behalf of her members.
Thanks, Shane, and good morning, everyone. It's a pleasure to be here. As introduced, my name is Lynn Bickert. I'm the Assistant Secretary Business Manager at the Hospital Employees Union. My pronouns are she, her, and hers. And I also want to acknowledge that I'm on the unceded traditional territories of the Coast Salish peoples, the Squamish, Musqueam, and Tsleil-Waututh. I also want to bring greetings from Mina Broussard, our Secretary Business Manager, who was invited to participate on this panel. And she's out meeting with our members today, so I will be bringing the greetings that she was going to bring. So the Hospital Employees Union represents more than 60,000 healthcare workers in BC that work in acute care, residential long-term care, community social services, and community health. I'm going to tell you a little bit about myself. I've worked in occupational health and safety for more than 40 years. I know it feels like a long time, 30 of those in the labor movement. And, you know, about half of those as the Director of Health and Safety at the BC Federation of Labor. And it is there that I met Wolfgang more than 2 decades ago, when he was so skillfully and passionately advocating for the importance of effective disability management programs that put workers at the center. And you heard Wolfgang today, and he still has that same passion. And his story is a testament to why disability management programs and our attitude, as he said, are so very critical. For me personally, my real learning has come actually from my 16-year-old twin nephews, Gabriel and Elias, who were born with cerebral palsy. Witnessing their many challenges that they've embraced and overcome with fabulous supports and advocacy from their families, their teachers, and their care providers is a constant learning for me. They have learned to be the best advocates for themselves and for others, to speak and to expect that the world, to speak up and to expect that the world will embrace, support, and respect their inclusion. They just expect that. And partly it's because of the people that they manage to be around, but that's what they've been taught. I've also learned in terms of workplace injuries and illnesses, and as Wolfgang's story tells, that prevention is the key and is absolutely necessary. It's absolutely necessary. And Aman just talked about that. We need good working conditions for members. We need healthy and safe, physically and psychologically healthy and safe workplaces for workers so that we do not have the injury rate that we have. And I see disability management, it's a continuum. We need to prevent the injury. We need to provide benefits and services for injured workers and provide disability management programs that make it possible for injured workers to return to work in a meaningful and a sustainable way. Finally, to bring people with disabilities into the workplace, which we must do, which also needs to be part of this conversation and which we all very much want to do, it is our responsibility to create and provide physically and psychologically healthy and safe workplaces for all workers, so that workers that we invite into our workplaces have that in addition to the workers that already are in that workplace. So a bit about the HEU EDMP program. People have already talked about it. The HEU, through the Health Services and Support Facilities subsector program, is a major partner in this jointly negotiated program. The program is for our members with occupational or non-occupational injury. It's mandatory for members who have missed one shift to workplace injury or missed 5 consecutive days due to non-work related injury. The program also has 18 EDMP stewards that are on an employer paid union leave. We don't have 1 or 2 staff at HEU that work with the program. We have 18 EDMP stewards that are taken off the job, employer paid union leave, that work with our members that are wanting to return back to work, that are part of the program rather. And these EDMP stewards participate in a comprehensive training program when they first begin. And actually right now, they are in a 2-week, our new EDMP stewards are in a 2-week training program to begin this very important work. And they have also continued education through the course of their work. The steward program is directed by our administrator, Eileen Martin, and coordinated by myself. The EDMP stewards work with our members, helping them navigate the system for their recovery and return to work. And you know, between the 18 stewards, they have about 3,000 files. So they have a lot of work to do. If you talk to the EDMP stewards, you learn that they love their work. They love working with the members and helping them to navigate the system, which I think is key to the success of the program. And what our stewards have told us is that the information is always changing. Members are overwhelmed about the massive amount of information that's needed to navigate the system, and that our members find it hard to keep up with the ever-changing information, whether it's labor law, COVID rules and leaves, EI, 15-day sick time, whatever the case may be. So to have the stewards be able to help them navigate the system is really important. And communication obviously is key. And of course, we have to remember that workers are not a homogeneous group, and we need to deal with different situations, equal different experiences, and consequently different approaches. So why is disability management so very important? We've all the speakers have talked about that and have made the case for it, and we know that it's super important. And you know, I was just reading a document the other day, yesterday actually, about it was an evaluation of a particular disability management program, and it was written about 20 years ago. And for more than 20 years, this is what we've been saying. Healthcare has the highest number of time loss claims and the number of days lost to workplace injury. Higher than, and you can fill in the blank depending on what the decade is, higher than logging, higher than construction, higher than others that we think are higher than healthcare, the highest. In all sectors in British Columbia, in 2021, the injury rate, and we all know that the injury rate is just one small number that we look at in terms of how things are going in the workplace. But in 2021, the injury rate for all workers was 2.3. In the healthcare sector, it was 4.4. In acute care, it was 5.2. And in long-term care, it was 9.2, more than 4 times the provincial average. We have a problem. And in 2021, there were just in long-term care, 2,465 claims. And these are accepted claims, not claims that were filed. These are also not workers that didn't file a claim. And overexertion is still at the top. Then exposures to biological substances, then violence, and then slips and falls. The total cost just in long-term care, just in 1 year, was $25,644,137. Unbelievable. The number of days lost were, oops, just hang on. Got to go back to my stat here. The number of days lost was 115,423 in 1 year, just in long-term care. And that is equal to 462 full-time staff. This is in a sector that's working short-staffed and totally overloaded every single day, long, as a man said, long before there was COVID. And so also in a sector where we are working hard, collectively working hard to recruit, to train, and to retain in the workplace, which is totally critical. We're always looking for more workers. And here's a place to start. And I'm not suggesting for 1 minute that people aren't working on this. They are, but we're not going in the right direction fast enough. When we look at COVID claims in healthcare, 8,452 registered claims at the WCB. 3,895 were in long-term care. 2,621 were in acute. And almost all of those claims were accepted. And primarily because workers that worked in outbreak sites filed COVID claims, and because of the presumption, but they would have been accepted anyway, presumption or not. That's my view. And these are COVID claims. What we don't know, and I think would be an incredibly interesting statistic, is knowing what the psychological injury claims cases were. What is the psychological impact on workers from experiencing working in a COVID outbreak site, witnessing residents dying, fighting for their own health and safety? And, you know, I have to remind myself, because it was almost 3 years ago, that the work that our members had to do, the work that all healthcare workers had to do to get the right personal protective equipment. Let's remember, now we take masks and we discard them. There weren't enough masks. One small thing, it seems like, but the fight was huge. And what did that do to the workers that had to be there every single day and provide the best possible care that they could? So I think that, you know, the stats speak for themselves, why the program is important and why our work in the program is important. We, you know, other speakers have spoken, and it's well documented that for economic and psychosocial reasons, workers want to and they need to be in the workplace. We need them in the workplace. they are productive, their work is valuable, they are valuable. And if injured or ill, they need to be able to return to work in a meaningful and safe way. And the safe and meaning return to work must be sustainable. That means they need resources, they need good accommodations, they need a good, safe workplace to go back to. Shane referenced early on, I believe it was Shane, that we were doing an evaluation of the program, and that has not yet been complete. But we've had a glimpse, which, I can share some of this information with people because I think it's helpful. And that is that what we were looking at is whether people in the program, whether it was our members, whether it was managers, whether it was disability managers, whether it was the union reps and the stewards, understood and respect the program, whether the program was efficient, what the duration numbers looked like, was it sustainable, and did it reduce costs? And of course, I don't have the information on most of those things, but what I do know is from the preliminary look that I had is that people do understand and respect the program. And I think that is a really good starting point. They understand and respect the program, and we got to stay with it. We got to improve the program, but they understand and respect it. Also, workers that are in the program would recommend the program to others. Also, super important. And they found it easy to follow. They with the help of, with the assistance of their stewards, they were able to navigate the system. One thing that I think that, we could do a bit more work on, and then the survey is showing this, although I'd like to see the particulars of this, that, the program promotes a safe and accessible and healthy workplace. And that's true, but I think those numbers could have been higher. So we'll wait to see once we see the crosstabs, but it points to where we might be able to do more work. And I guess, just to close, like one of the more concerning things that I found in the survey so far was, and that need attention, is when members were asked, when workers were asked, my participation helped maintain a connection with the workplace, which we know is so, and why so many workers do not return to work, because before these programs existed, there was no connection between the workplace and the worker. But the numbers are not as high as I would like. And so that is an area that we certainly need to work on. And my participation helped me get back to work safely. About 2/3 of the members said that that was the case. I think that's also an area that we could work on. And then my last comment is that when you look at how the workers and the managers answered certain questions versus how the stewards, the union reps, and disability managers answered the questions, there's quite a gap in terms of perception. So I think that as a disability manager or as a union rep, that the program is working well, and you talk to the workers, and it's considerably less. And so this one example was that, program steps are easy to follow. That was about the same. But in terms of the timeline and getting people back to work, there was a huge gap. And I think we need to deal with those kind of perceptions, because with that gap, because if we don't deal with the gap, we'll just keep doing the same things that we're always doing and thinking it's working. And we really need to go back to the workers that are in the program to ensure that they are getting what they need. So in closing, I think we just need to remember why we do this work. And really, it's our collective belief that workers must be treated with respect and dignity. They add value to the workplace. They're missed when they leave. They're missed if they don't return. And both Wolfgang and Craig both talked about, workplace attitudes and the 3 C's: creativity, collaboration, and commitment. And that's what's going to see us through improving the program. And we do it we do it for the people that are in the program to ensure that they have a better life. So thank you for inviting me to be on the panel, and I've enjoyed hearing the speakers.
Thank you very much, Lynn. A couple of quick comments, and then I'm going to ask Lanny to kind of explain a bit more of the detail of connecting the EDMP program and the workplace development program. Two quick things. One is if you are eligible and looking at continuing education credits, to know that this webinar is eligible for that, and there'll be more information, I believe, sent out in the next day or so as to how that works. I think Lanny knows about that. And we're closing up on getting close to the end of our time, but hopefully we will have a few minutes at the end for some questions in that. And if you want to if you have questions, you can write them into the chat box, and we'll do our best to get to some of those if people have questions moving forward, though we're a little tight on time. I'm going to turn it over to Lanny now to talk a little bit about how we connect the WDA and the EDMP program moving forward.
Thank you, Shane, and thank you to all of the speakers. It's always interesting. I've done this a few times, and there's just different perspectives. I continue to learn every day, which is why I'm so excited about this work. And thank you to Wolfgang and BCNU for supporting me in this secondment, this role, and this opportunity to bring people together. So I can't see folks out there, but I know this is my group. You know, these are people I've worked with for years, and it's people who work within the Enhanced Disability Management Program in some capacity. And so thank you for joining us today. Shane is right. We started this 10 years ago, November of 2012. We went live with Fraser Health and have been moving forward ever since. And we started off EDMP as a collaboration, and it's been going that way since. And I think that's a really key piece, that we continue to build on that creativity, collaboration, and commitment as a community of learners. We did joint education when we did the rollouts, and we continue to do that joint education now, and through this webinar, but also through some special modules that we've put together, and we'll continue to do that. And that is funded through the Workforce Development Grant. I know many of you have heard about it through my emails to you, and our promotion of that, and creating some different learning opportunities to work within your organizations, but also that community of learners as we come together with employer groups, disability management professionals, unions, insurers, our Canada Life partners, HBT, etc. So we will continue to work with those funding opportunities. I've got some more information coming out to you in an email, in what I'm calling a one-pager, that will again look at the opportunities to increase your knowledge and professionalization within the workplace, but also supporting employer programs in terms of workplace audits that are available. And I think, as my final thought is, as workplace leaders in disability management, EDMP is an example of how we work together and lead in this industry. And that's what's going to be needed as we move forward with the Accessibility Act as well. We have the ability to lead in that section, make sure it's on the radar, talking to our human resource counterparts, our labor relation colleagues, etc., to make sure that this is moving forward. Not just accessible for people who work there, but like Lynn said, we need to hire people with disabilities. We need to open up who we're looking at hiring, and organizations that accommodate their own disabled workers are setting that stage and that culture to hire workers who are from outside the organization with disabilities. And that, for me, is what is exciting, and that's the opportunities that arise through this grant. So Shane, I think I will leave it at that and hand it over to you. Thank you.
Oh, great. Well, thanks very much, Lanny. And again, there is an opportunity for a couple of questions if people had it. At this point, we don't have questions. I don't see them on the chat box, and I'm pretty Luddite about this, but I don't see them. I guess then, if there aren't any questions, we're going to get close to kind of finishing on time here at 11 o'clock.
James, sorry to interrupt, but I do see a question.
Oh, I don't see it. So
It's in the questions forum right beside participants, right on the bottom of the screen. It says, as you mentioned, Lynn, how can we close the gap between case managers and EDMP union replies?
Was that to me?
That was to you.
Sorry. Well, I think, yeah, how can you close the gap? You know, it's without giving you specifics, I think that communication, trust, and building good relationships is really how you close the gap. These things are time consuming and they require a lot of work and effort and collaboration, but there really is no secret sauce. I think the secret sauce actually is the ongoing communication and you know, closing the loop between, well, I thought you knew, and assumptions, and just being able to do that on a regular basis and having, you know, complete respect for the person that they are working with to ensure that they're returning back to work safely.
great, thank you. I'm not seeing questions, so is there anything else, or are we good?
That was it.
Great. Well, and just again, on behalf of NIDMAR and everybody who's participated, a huge thank you to the panelists, a huge thank you to all the people who participated and are part of this webinar. We all are committed, and the people who have joined us today are committed to this work. We know it's about having effective plans. We know it's about early intervention. It's about accommodation, and it's about collaboration of all the partners to be successful. NIDMAR is committed to that. We're thankful to the government, the provincial government, for providing some resources to allow us to expand our work around professionalization, around training, around audits and assessment. We're very appreciative to our partners in this, and we're very appreciative to you who do this work every day in the healthcare sector moving forward. We look forward to continuing to collaborate and to be able to work together as we do this work, and to stay committed to the belief that everybody needs to have opportunity. Everybody needs to have a chance to have a successful life. Everybody needs to have a chance to realize their dreams around their and the life that they want. And persons living with disabilities, persons who are struggling with injury in that, face even greater challenges than others. And so we need to continue to work to improve everybody's lives. And so very much my appreciation for all of your efforts. We hope you found this helpful and useful. And we look forward to continuing to work together with the professionals in the healthcare sector and the people in the healthcare sector who make the EDMP program work every day, as we look to build this program further in healthcare and look to take it from healthcare into many other sectors where, quite frankly, they're not as far along as health is in terms of plans. And so you're breaking ground on this with the work that you've done over the last decade. And we've learned from it at NIDMAR, from your work, and look forward to continuing to build this in healthcare and build it elsewhere. And again, thank you to everybody for participating, and have a great day and take care.